is the essential medical drug list, 1,000+ product, but they are also manufacturing quite a few of other products that are pharmacy related, that are treatment related, that are catering to different segments, and also for general health and general well-being of the consumers, not only the patient. So it's not that it's a scary situation. We have strength in local manufacturing. We have strength and capabilities that are existing in the local manufacturers that are catering to many of the products that are being supplied in the pharmacy. So one, remove the fear that we don't have products. In the space of supply chain availability or getting to know, I think we should start first from the essential medical drug list of which are those products that the local manufacturers can have capacity to manufacture, and what are the pain points of them not being able to manufacture and service the market, and hence products are getting imported from outside. But also looking at how we can get, well, of course, now with PPB moving to ML3, we should have avenues and we should have negotiations, intergovernment maybe, donor-funded maybe, development partners maybe coming together and having or assisting conversations of tech transfer. Why should products be manufactured in different parts of different continent and coming to Africa? Why can't it be manufactured in Africa for Africa is what we should look at. Why can't it be manufactured in Kenya for Kenya and beyond Kenya as well? Because we have the strength in being a good local manufacturer in the entire sub-Saharan Africa. It's not only East Africa, but in the entire sub-Saharan Africa. A lot of our Kenyan manufactured products moves right up to Malawi, Zambia. I think we are not able to go down south because the cost of transportation and logistics is what is hampering moving the products further down south into the Southern African market as well. So if we merge products that Med supplies, that KEMSA supplies into the market, and you find out that it's not 15%, it's more than 35, maybe 42%, if we take an average of all the products that these two entities are supplying in the market, are local manufactured products. So it should give us a good feel that we have avenues for further growth. We have avenues where the 1 billion population that Dr. Sioi spoke about, 1 billion plus population that we could cater for. So how do we build capacity? How do we ensure that there is visibility? And how do we ensure that we open up these markets for our local manufacturers, what we should look at?
Yeah, Dr. Tim.
Mine is to say that we need a value chain-based approach as we're bolstering local manufacturing so that the entire value chain has visibility of what is being manufactured, what is being produced, and what is the availability like. One of the groups that we must target are healthcare workers, just to let them know what is happening in the local manufacturing space, so that we inculcate the buy Kenya, build Kenya. Because without that, we will not have drivers for demand, first locally before we even go regionally, and subsequently internationally. The second thing is data. The sector needs a lot of data that is being produced by the value chain. And I'm happy to hear the conversation of the digital superhighway that the Ministry of Health has really been pushing. And once we contribute to that data, and I'd like to urge everyone in the value chain to contribute to this data, because it is not only useful to yourself, but to everyone else. And when everyone else is able to have their business move to the next step, so will you. So we need that data for them to know what the trends are like. And thirdly, we are having an epidemiological shift in the country in terms of the disease profile, moving from communicable diseases to non-communicable diseases. So how are we becoming industry ready as a manufacturing segment for us to move to that? You asked what KHF is doing. We aggregate business member organizations, and these are the conversations we have with them. We are part of a consortium funded by USAID on local manufacturing, and as the conversation advances, we may house a secretariat that will bring to life the thoughts of that project. And now with that, we hope to bring better coordination into the segment so that we're able to spur the growth